Contrary to the perception that most people on welfare are just jobless people abusing the system, Public Health Director James Gillan says that's not the case. He was one of the speakers at EOG's Conference on Public Administration today, where he also talked about how the Compact of Free Association, or COFA, is affecting our public assistance programs. Department of Public Health and Social Services Director James Gillan gave a presentation on how the Compact of Free Association, or COFA, has affected Guam's public welfare programs, and the numbers are staggering, showing that for many of the programs, such as Medicaid, MIP, food stamp, cash assistance, and Medicare, a significant portion of the beneficiaries are citizens of the freely associated states.
We have about 56,000 people, residents of Guam, who are enrolled in either our Medicare or our Medicaid program. But of these two programs, as of 30 September, almost 33% in those two programs are people from the freely associated states. In our MIP program, which is the 100% locally funded program, okay, we have about 12,033 people in that program. And of that, 68% are from the FAS.
Gillan says while the government is bound by COFA, the island is not getting the federal reimbursement needed to accommodate these numbers, and this in turn has a ripple effect on the livelihoods of many of the migrants who come to Guam under the COFA.
Everybody's welcome. I think what the danger is when you're all leaving your homes for a better life and then you find it's not that much better. There are homes abandoned. They're almost like ghost towns because people have come to Guam for a better life and they're here. And they find that it's not that much better.
In fact, Gillan says there's a common misconception that many of those under welfare programs are just jobless people abusing the system.
I think the other thing that happens is when they're here, they have low-wage jobs. Matter of fact, most of the people on our SNAP program, whether they're FAS or whether they're locals or whatever, most of them are working families or the elderly. They just don't make enough to get enough to have a nutritional food. And until we pay decent wages and until we build this industry that people are ready to do, they're ready to take, we can do some good things for our brothers and sisters from the FAS, and we need to, okay? Their ocean is overflowing. Their taro can't be grown because the earth is too salty. There's too much salinity in the soil. They're seeing their life and their livelihood just melt away because of whether you call it climate change or whatever you want to call it. Okay, it's happening. It's real. But again, the challenge for us is to get the best care possible to everybody, and it doesn't matter where you're from. Thank you.
Again, Gillan was one of the presenters at the University of Guam's Western Pacific Conference on Public Administration and Policy Solution.